Good morning, everybody. Thank you so much for being here today. My name is William Miller, and I am the State Director for Protect Our Care here in Florida. And we are joining you today from Orlando, Florida, as part of our Highway to Health tour, as we urge our leaders to take action, including lowering prescription drug prices, reducing premiums, expanding Medicare, and closing the Medicaid coverage gap for millions of the uninsured, including over 800,000 folks right here in Florida. Earlier this week, Democrats in Congress, including two of our speakers today, took a step towards that goal by voting to advance the budget agreement that includes historic investments in healthcare for millions of Americans. Now, we're here today in Orlando at the first of our two stops in the great state of Florida, as the bus behind me, Care Force One, travels over 8,000 miles across the country with 36 events in 19 states. We're joined today with an incredible roster of speakers, including Congressman Darren Soto, representing Florida's 9th District here in Central Florida, as well as Congresswoman Val Demings, representing Florida's 10th District, as well as Jennifer Dotson, a local Orlando resident and healthcare advocate, with a story on the cost of prescription drugs and the need to expand Medicaid. And also Laura Packard, a national healthcare advocate and stage 4 cancer survivor. And with that, I'll give it up to my first speaker, Congressman Darren Soto. Thank you so much.
We know the deal. Care Force One's in town. The Build Back Better tour has reached Central Florida, and we're here to protect our care. This week we had a historic vote, a unanimous vote among the Democrats to proceed on bipartisan infrastructure, to proceed on the Build Back Better reconciliation package, and we also passed a long time coming, the John Lewis Voting Rights Act. Let's hear it, everybody. Our message is clear. President Biden and the Democratic Congress, we are united to protect our care and to build back better. We're fighting to expand Medicare. We're talking about Central Florida seniors, many of whom have worked their whole lives here, and others who came to sunny Central Florida to retire, by expanding access and covering hearing, dental, and vision. A long time injustice. And isn't it about time, friends? Isn't it about time? We're also going to be expanding Medicaid, something that is an original sin here in the Florida legislature, as they refused since 2014 to help give coverage over nearly a million Floridians who fall in that coverage gap between Medicaid and the Obamacare exchanges. We're going to do this either by allowing them to apply for Medicaid expansion coverage through the federal exchange already existing here in Florida, or through local governments drawing down these grants. We need to get this done. We're talking about an average family of 4 where 2 parents are working in our local theme parks or hotels, folks working every day and having trouble to make ends meet here in Central Florida, and they can't afford health care. That's an injustice, a wrong we're going to right here with the Build Back Better agenda. And we're also going to help our seniors by lowering prescription drug prices, by making sure Medicare can negotiate drug prices just like the VA and Medicaid already does, by limiting out-of-pocket expenses to $2,000 a month so seniors don't have to cut their medications in half, or even worse, forego their medications because they can't afford it come the end of the month. And then that Medicare savings will apply to private plans. So we're talking about helping folks with private insurance, including the 2/3 of folks in my district that have private insurance. And I'm honored to serve on the Energy and Commerce Committee, where we will be working on these healthcare issues directly, along with amazing champions here in Central Florida. To build back better, we need to expand access to affordable health care. We need to lower health care costs for Central Floridians. We need to create high-paying jobs and save the lives of many Central Floridians' hardworking families. And I am honored to be joined by a hardworking and incredible colleague, an outspoken champion for health care both in Florida and across the nation, my colleague and dear friend, Congresswoman Val Demings.
Let me say good morning to all of you and express how honored I am to be here with you today to discuss this critical issue. I want to thank Protect Our Care for the thousands of miles that you have and miles that you will travel and the work that you are doing on the ground to make sure that every person living in this country has access to health care that is affordable. Also want to thank my colleague, Darren Soto. I am honored to serve with him. I am pleased at the work that we have been able to do working together. I also want to acknowledge one of my constituents, Jennifer, who has joined us to tell her amazing story. As you all know, as a nation, we have a lot going on. We have a lot going on domestically, and we have a lot going on around the world. But even with all that we are currently experiencing, I say this today with the utmost confidence that we are the greatest nation in the world. But I also want to say, though, that membership then should have its privileges. Jim Clyburn, another amazing colleague, likes to say this, and I think it really frames our conversation here today and puts the work that we are trying to do into perspective. Our majority whip says that we don't need to make America great again. America is great. It always has been great. That is not the challenge. But the challenge to me is how do we make the greatness of America accessible and affordable for all Americans? I thank Jim for those words. Look, I don't particularly care what position you're in or what party you're in. Our number one responsibility as elected officials, as true leaders, number one, is the health, safety, and well-being of the people that we represent, the health of families, the health of our seniors, the safety and well-being of people. And we should never make that political. But unfortunately, and we know the last year and a half has really, I think, put a bright light on the injustices in health care in this country that is the greatest country. As we deal with the unbelievable number of deaths around our nation and around our state, we should never make our response to any crisis, and certainly not a public health pandemic, political. Every American, regardless of who they are, the color of their skin, where they live, or how much money they have, should have access to quality health care, should have access to health care that is affordable. We have ways that we can do that, and my colleague highlighted some of them earlier. We can allow Medicare to negotiate the cost of prescription drugs. We can expand Medicaid. If we know that expanding Medicaid not only provides coverage, but also provides financial stability, why wouldn't we want to do that? And Florida, shamefully, is one of 12 states, only 12, but 12 too many, that have refused to expand Medicaid to provide coverage to those without it in a country that we say is the greatest country in the world. In terms of Medicare, why wouldn't we include vision care and dental care? Why wouldn't we include care for hearing to not only improve the overall health of our seniors, but to improve their quality of life? Ladies and gentlemen, we are living in some critical times, and we're facing some critical issues. But I think it's fully unacceptable that we in America pay more for prescription drugs, for example, than any other country, that we here in America pay 3 times more than any other person in another country. If we are who we say we are as a nation, then we have to live up to America's promise and do what the majority whip says our marching orders are. Let's make health care accessible and affordable for every American. Thank you all.
Thank you so much, Congresswoman Demings and Congressman Soto, and thank you so much also for your vote to advance this historic budget measure earlier this week. Next to speak is Jennifer Dotson, a local Orlando resident and healthcare advocate with a story to tell on the cost of prescription drugs and the need to expand Medicaid. Jennifer.
Thank you, everybody. I'm not typically a public speaker, so I'm kind of nervous, so just excuse me. My name is Jennifer Dotson. I've lived in Orlando since 1979, and I don't have health insurance. I fall in the Medicaid gap, and I have several health issues. I have chronic obstructive pulmonary disorder, which is COPD, makes it hard to breathe. I have an enlarged heart chamber, multiple dental issues, and cataracts. And without health insurance, I can't get any of those things fixed. I can't get any health care. I've had to resort to GoFundMes to try and pay for the cataract surgery. It's $4,000. I got $500. I just hope that with everybody coming out here that we can all work together and expand health care, expand Medicaid. Like Val Demings said, 12 states and Florida has to be one of them. I moved here in 1979, and this was a wonderful state when I moved here. I was absolutely awestruck when I got here. Not so much now. But just thank you very much for coming out, and thank you, Will and Val and Darren. Without you, I don't know where we would be. Thank you.
Thank you so much, Jennifer, for coming out today and sharing your story. Last to speak is Laura Packard, a national healthcare activist who's been riding on this bus and stage 4 cancer survivor. Laura.
Hello, everybody. My name is Laura, and 4 years ago, I walked into a doctor's office with a nagging cough and walked out with a stage 4 cancer diagnosis. I'm still here today because the Affordable Care Act saved my life. But too many Floridians are not here today because they can't afford health insurance. And it is a shame that Governor DeSantis and Republicans in the legislature refuse to do their job and expand health care to the neediest Floridians. And it is an equal shame that Senators Rubio and Scott refuse to vote for health care for all of us. We're going state to state across the country talking about the Build Back Better bill, which not only would make Affordable Care Act plans more affordable, but fill the Medicaid gap in places like Florida, where the state legislators refuse to do their job, and expand Medicare to include vision and dental and hearing for our seniors, and lower the cost of prescription drugs. While I was going through chemo, my doctor prescribed a drug to me to help my immune system recover faster. That drug was $13,000. So I went without, and I wound up in the hospital for a week and almost died. No American should be forced to make this choice. In the richest country in the world, we have got to do better. The drug that was prescribed to me was based on research we already paid for. We as taxpayers fund the NIH that does all kinds of amazing scientific discoveries, which then Big Pharma charges more and more money for us to access. And now we have a chance to do something about it. Thank you to Congressman Soto and Congresswoman Demings for your votes so far for Build Back Better. And we know you're going to keep pushing for health care until every Floridian has what they need. Thank you.
Thank you so much for everyone who came out here today, for our speakers, and for joining us today. As all of our speakers have shared today, healthcare, expanding and improving our healthcare, especially in the state of Florida, could not be more critical. Making sure that healthcare is a priority in the upcoming legislation is not only the smart policy, but it is the right thing to do. Thank you again for joining us today.